United States, United Kingdom, and New Zealand healthcare comparison. Comparing American and New Zealand healthcare systems. Comparing the healthcare systems of the US and New Zealand, it seems important to note that they are rather different. Even though both countries make their efforts to continuously enhance healthcare access and quality for patients, New Zealand seems to be more successful. As you noted, while the latter spends 11% of its GDP on healthcare services, then the US has to budget 14% in the same area. More to the point, summing up the facts revealed in the peer review, it is possible to note that mortality and morbidity rates of both countries also show the greater effectiveness of New Zealand's system. Indeed, a recent study funded by the Commonwealth illustrates that the healthcare spending of the US surpasses those of other large countries. Perhaps, it is partially associated with the type of healthcare system accepted by the US as well as with specific health problems. The US has a smaller elderly population and fewer smokers, but higher obesity rates. Elaborating on the mentioned point of healthcare spending, one may note that New Zealand's expenditure on overweight and obese people accounted solely for 4.4%. Even though the above percentage is considerable for the country, it is less than in the US and on a global scale. It also seems essential to emphasize that plenty of Americans live without insurance coverage, deprived of the opportunity to access healthcare services, while New Zealand's government funds public health, thus providing citizens with the necessary health assistance. Comparing the US and the UK healthcare spending. The comparison of healthcare spending of the two G7 group countries, namely, the US and the UK, specifies that the former ranks first place with regards to healthcare expenditure. It is anticipated that these amounts will grow with time, leading to the fact that 26% of the American GDP will be involved in their coverage. According to Milstead, the healthcare system is composed of a range of factors that affect its overall effectiveness. With this in mind, the review of scholarly data shows that the US healthcare system presents several challenges despite the initiated changes. Speaking of the financial aspect, one may note the lack of adequate access and affordability along with insurance complexity. Even though the country spends significant funds for supporting healthcare, the hybrid system cannot provide the expected outcomes. On the contrary, the UK's exact healthcare services paid by patients and out-of-pocket spending prove to be beneficial. For instance, one may consider life expectancy rates. In the US they are much lower than in the UK. Therefore, it is possible to suggest that there is an immediate need to renovate the US healthcare system that spends enormous funds and receives insufficient output. It should be outlined that the UK is the only one among Western countries where the vast majority of medical institutions belong to the government. In this country, the state health system dominates, supplemented by private insurance and paid medical care. Indeed, the UK's healthcare system may be utilized to learn about its effectiveness by caregivers, policymakers, etc., thus enhancing the one that is accepted in the US.